A long time ago, back in the 80s, my roommate, my best friend, after we graduated from college, she ended up donating one of her kidneys to her father. And I thought that that was just wonderful. And so at that point in time, I was living in Kentucky, and so I got involved with the Central Kentucky Kidney Foundation. And I helped them, I volunteered with them to do the Trees of Life. I thought it was a wonderful way to give back because I was just amazed at what a difference donation made. So many years later, I moved out here, and I always thought that I would be a donor. And I ended up with a blood clot that killed off my liver. So I had to have a sudden transplant. And I was actually in the hospital, and my kidneys started shutting down. So I was going through vision loss. By the time they put me in and evaluated me, they had to put me on dialysis. Fortunately, after I had my transplant, I was able to, my kidneys kicked in immediately, and they've been fine ever since. I do run a little bit high, and they do monitor me. But again, that's why I'm passionate, because I've been through it. So I worked for 25 years in the credit union industry. I actually worked in IT and marketing. And I thought credit unions were wonderful. I thought the philosophy was great. After I had the transplant in 2005, I started volunteering for the California Transplant Donor Network because I wanted to find out more about what I just went through. And I found out it was very helpful in my paying it forward to go out into the general public and talk about the importance of organ and tissue donation. And so when a position became available, it was wonderful. I went ahead and I applied for it, and I've been the volunteer program manager since 2009. So I have a vested interest in this, and it really is a passion. So thank you again for inviting me. And the way I put this presentation together is based around kind of my experience and the questions that I wish I knew, or the answers that I wish I would have had when I was going through it, but didn't have the time to find out about until afterwards. So I'll go ahead and get started now. So the California Transplant Donor Network, we service 41 counties, 175 hospitals, and we cover 11 million people. We're actually servicing the northern and central part of California, as well as the northern part of Nevada. So today I'm going to give you a little bit of an overview of what our role is in transplant, who can donate, the donation process, some statistics, and how you can help. This is our service region. So as you can see, we cover a large portion of California. The California Transplant Donor Network, we're a nonprofit organization. We're one of 58 organ procurement organizations in the United States. We're actually the third largest. There are 4 OPOs in California. And we're responsible for educating the community as well as the hospitals to work with hospitals so they stay in compliance and how they're supposed to work with us on organ donation. We also work with potential donor families, and we facilitate the recovery and placement of organs from deceased donors. Our mission statement is very simple. We're here to save and improve lives through organ and tissue donation for transplantation. And our values mean a lot to us, and it requires a lot of teamwork. I know when I was in the hospital, I went through the evaluation, was very grateful for the transplant center, but I didn't realize all the work that went on behind that. And I found out that you're not alone. I found that out when I was at the transplant center, because you have a wonderful staff that's working with you while you're a patient, but there's also another group of people that are working as a team, because we have to work within our organization along with the transplant centers and the donor hospitals throughout our area. So teamwork makes it happen. Integrity, we have to follow the rules and the procedures to make sure that we're allocating organs in a fair way. And finally, there's passion. We have all of our people that work at our organization are very passionate about what they do. We have social workers who are out working with the donor families, and it's an honor for them to be able to work with the families at a very, very tragic time. So we have a lot of volunteers that work with us, a lot of staff, and we bring passion to what we do because we want to save more lives. Just to give you an idea, we have about 200 employees, and most of it's clinical staff. We also have finance, we have HR, we have an IT department because we have to make sure we stay up. We have to make sure that we stay in communication. We also have a community development department so that we can go out and educate the community about organ and tissue donation. Because the more that they know before they'd ever have to be asked the question about donation, the better. We also have about 500 volunteers who go out into the community to help bring donation to their community and share their stories. Talk just a moment about donor types. We have deceased donors, and that's what CTDN deals with. There are also living donors, and as the Transplant Center does their presentation, they'll be talking more about living donors or cover that area. Sometimes we do get calls about from people who are interested in becoming living donors, and we always refer them on to the transplant centers. So people either decide that they're going to go ahead and sign up on the California registry, so they'll go ahead and make that decision ahead of time. Or we have to actually bring that topic up at the hospital, and the family makes the decision. And then we also inform the family of the patient's decision while we're talking to them. And at that point in time, they have the ability to do a directed donation, which means that if there's someone in their family or someone that they know, they can actually allocate that organ to that person, or at least give us the information, and we can process it to see if that person would be eligible for the donation. Because one of the things, they have to be on the list. They have to be active on the list. Then there will be some discussion about extended criteria donor. Again, I will leave that to the experts on when that may happen. Because there's criteria that's set on what organs will be allocated, but there can be exceptions. And people can accept an extended criteria donor, but I can leave that to the experts that deal with that. Then with the living donor, the transplant centers are working with that portion of it with directed from family and friends. And then, I don't know how many of you have heard of kidney chains? That's something else that's possible. And one thing I don't know whether you're aware of is back in 2010, there was legislation that was approved in October for a living kidney registry to be started in California, which would be the first of its kind in the U.S. And I heard from somebody just a few weeks ago that they thought that it might actually have more information out about the registry this year. I'm not sure, have you heard anything about that yet? Because that was just something I heard recently. But who is CTDN and how do we fit into transplant and what do we mean to you, those of you who are waiting? This is just kind of a snapshot of where we fit into it. We're the bridge between those waiting and those that are donating. So you've been referred to your transplant center and you've been evaluated. When you've finished your evaluation and it's been deemed that you're going to be placed onto the list, your transplant center will actually register you through the United Network of Organ Sharing, UNOS. So you'll appear on that listing, and they'll be talking back and forth. On the other side, while you're waiting, there are hospitals. We have 175 donor hospitals in our area. And someone will come into the hospital, a tragedy, probably brain injury, something like that. They will come into the hospital will do everything that they possibly can to save that individual. When it becomes apparent that it's going to be imminent death, by law, the hospital has to contact the organ procurement organization. So in our area, they have to contact us. So at that point in time, we're working with the donor hospital, and we're gathering information about the possible donor so that we can look at the criteria that's out there and make the decisions as far as, is that someone that can move on to the next step. Once that happens, it's been deemed that that person is eligible for donation, then we bring in our family services team. They come in, they work with the hospital staff, and they have the discussion with the family about donation. They either inform the family of the patient's, if the patient is already registered through the California registry, and if they haven't done that, then they go ahead and have the conversation about the next steps and offer donation as a possibility. Once we get confirmation that they're going to be a donor, then our placement department is working to get all the information that they need so that we put that into a computer system and we send all the information on that donor to UNOS. So at that point in time, we're actually communicating with them. They will enter that information in and electronically bring up a list for all the organs of all the people who are at the top of the list, who are eligible for that organ that's becoming available. And we have to then start making calls to your transplant surgeons. Because what we're doing is working to get those organs placed. So as soon as we have that done, then we start working on the other side of getting a recovery team together, setting up the transportation, and getting those organs to the transplant center so that the transplant can happen. So overall, we're running and we are acting as the bridge between recipients and donors. We also, in community development, it's important, again, that we have conversations out in the community. And one of the best things is for our Donate Life ambassadors to share their stories of how they were affected either by being a donor family member or if they've received the gift of life. And something that also makes a difference, people who've been waiting. It gives them an idea and puts it into perspective because then they've met someone who's gone through the experience. But it's much better if they've heard about donation prior to having something tragic happen. So we're also working on that side of it too. This is a little bit of information about the United Network of Organ Sharing. You can actually go to their website and find out more. But you can go to this website, you can see the numbers of who's waiting in general. But that organization is set up to actually manage the national waiting list. So they get all the patients that are out there. Everyone that's on the wait list is on the UNOS wait list, and that's located in Virginia. And so every organ procurement organization that's working with this goes out and works with the same system. How do people register? People register here in California through the DMVs or online at Donate Life California if they want to go ahead and make their wishes known that they want to be an organ and tissue donor. And actually 98% of the people who register through the DMV. Again, living donors contact the transplant centers, or if we get the calls, we refer them to the transplant centers. And again, there is a living registry in the works. But this is just a snapshot of what the Donate Life California website looks like, and people are directed here where they can go ahead and sign up directly on the registry. They can make the decision as far as what organs they want to sign up to donate, tissue that they'd like to donate, and this is also another great place to get information about organ and tissue donation. In the case of imminent death, families must be given the option of organ and tissue donation. This is required by law. And so, who can be a donor? For organs, generally, a patient must be in a hospital on a ventilator, because the organs have to have blood to be maintained. And then organ donation may occur from brain death or donation after cardiac death, which brain death is the irreversible cessation of brain function, including the brainstem. People do not come back from brain death. And this is just a list of some of the causes of brain death. But brain death is not a coma. And most of our organ donations do come from brain death donors. Donation after cardiac death. These are patients that do not meet the criteria for brain death. There's no chance of survival off the ventilator. And at this point in time, the hospital staff is working with the family, and we're out of the picture, because this is when the hospitals are talking to the families about next steps. And if the family chooses to withdraw life support in this situation. If they do choose to, then the recovery occurs following the pronouncement of death, and it has to happen within a specific window of time. So for this to happen, once the support is withdrawn, the person must die within an hour, or else at that point in time, the organs will not be able to be transplanted. Potential versus actual donors. Sometimes people wonder why don't we have more transplants? Across the country, there's 2.6 million deaths every year. But that reduces down to 12 to 15,000 potential organ donors. And a lot of that happens because of where someone dies, or it could be other circumstances. But by the time it gets down to the 12 to 15,000 potential organ donors, we're there and we're taking a look at the criteria to see if they can move on to the next step. Which across the country, out of the 2.6 million, it turns out to be about 7,000 donors per year. And that equates out to about 25,000 transplants. So we're working to try and get as many possible transplants done as we can, as many possible organs that we can. And a lot of times people will rule themselves out. So when we're out talking in the public, we always talk to people about don't rule yourself out. Because that's some of the myths that we have to talk with about the public, and then our family service have to cover when they're having conversations with the families during a tragic time. A lot of it comes up, and sometimes they say no because of myths, things that they've heard. You know, sometimes it's, well, my religion doesn't allow it. All religions allow and support organ and tissue donation. You know, there's a lot of people that think they won't save me. You know, so there's a lot of myths that we have to get out there and solve, because otherwise that can be people that will take the numbers down from the 12,000 to the 7. How does the organ donation process work? Again, someone comes into the hospital, they've had some sort of brain injury. The hospital is working to save them. They've done everything that they can. It's imminent death. At that point, the referral happens to us. So the hospital calls CTDN. We actually assign a transplant coordinator who starts evaluating. They call the hospitals, they start getting information to find out what about the function of the organs. They get as much information as they can because they're doing preliminary evaluations to see, can this person move on? If it's determined that they can, then we work with the hospital and we have family services who comes in and sets up the scenario so that they can go in and they can talk with the family. So while that portion's going on, once it's determined that they're going to become a donor, then we have placement staff who works to go ahead and get all the data that we need in so that they can put it on so that we can contact UNOS and get the list of people who are on the list that would be compatible for that organ. And again, then that's at the point where we start calling the transplant centers, getting that portion of it set up. We also go ahead and set up the transportation to get the organ back to whatever transplant center that it's going. We're actually medically managing the patient at that point in time. We actually resume coverage of the patient. So we're in the donor hospital, we're managing the patient, we've got people that are calling, getting everything set up. Recovery team comes in. We have to actually set up an OR, and sometimes people wonder why maybe when they're called it takes so long. Sometimes we have to reschedule, there are things that come up because we can't actually start the recovery until we have every organ placed and we have the OR scheduled and we have the teams in place. So once it starts, then we go ahead and we do the recovery and get the organs out and to the proper transplant centers. Kind of put this in perspective, I know one thing I wondered when I had my transplant, mine happened suddenly. And so I had my transplant on the 18th of the month. And they came in probably on the 15th and said, we think that something's probably going to come up in about 72 hours. And I thought, how did they know that? How did they know? And after I had the transplant, a few months later, I actually got a letter from my donor family. And so they put pieces into place for me. Because what actually happened was my donor had an accident. He was on a motorcycle and going to work, and there was a 6-car pileup. So he was taken to the hospital on the 11th of the month. And that's where they did what they needed to do to try and save his life, because he had brain injury. After they did everything they could, they brought it to his family and said, he's not going to make it, he's not going to survive. And they brought in our team and they talked to them, and the sister made the decision that he would be a donor. And we supported them. And then on the 18th, the organs arrived at the transplant center, and I had my transplant. And while my transplant was going on, there was a kidney transplant going on in another OR in the same hospital that was from the same donor. Now that can vary some, but from what I've seen, that seems to be more common. There can be shorter times, there can be longer times. But that was one thing I had always wondered, why? Why did it take? And you don't know whether the OR had to be rescheduled or something didn't happen and they had to reschedule some part of it. I'm going to give you an overview of placement. We actually have a placement department, and so they're the ones that are working to match the donors to the recipients and to offer the organs to the surgeons But we've got 8 full-time people, we've got 5 per diem. They work 12-hour shifts. We have someone on call every day, every hour, 7 days a week, 365 days a year. Most have a medical background, biological background. We have, I think our supervisor, she has a genetics background. We have people that are EMTs. We have people that are hospital, have degrees in hospital management. But some of the things they do, they have to make sure, and going back to directed donation, again, for a directed donation to go through, one thing is the person has to be registered with UNOS. So they have to be listed. Potential recipients have to be on the list, and then the recipients are paired with the donor based on the algorithms for that particular organ, and the priorities given based on each of the policies and procedures that they have set up for the organs. This is a sample kidney waiting list. So this is what actually came out after a placement staff member put the information in about the donor. And so this is what would come out. It would actually show the people over here would be the people that would be called first. So it would be the transplant center that would actually be called first. And we call multiple transplant centers. We call at least 3 people at a time. We'll give the first offer, and then they can go ahead and make the decision. They have an hour to make the decision on whether or not they want to accept that organ. We also make calls to other people on the list, and we follow the list. And we offer it until someone says yes. When we're offering, we make the local offers first. So we actually try and get everything placed in this area. If the offer is not accepted in this area, then we go ahead and we go regionally. So we'll actually make calls then to Arizona, New Mexico to try and place the organ. And then after that, we go further out. Because of the need in California, import offers are very important to us. So there's other transplant centers that are contacting us to place organs. And again, because our numbers are so great, it's important for those to come out to us. Our placement department, they're the ones that actually do make the offers to the surgeon. When they make the offer, they call the surgeon and they talk to them about everything they know about that patient. They find out if the surgeon has any questions about it, any other tests that need to be done. If they accept, then the surgeon informs the nurse coordinator, the organ specialist, the social worker, and the recipient. And one of the other reasons why we go ahead and we have more people in line is because if they find out perhaps that the recipient's not available, maybe they're out of the area. If they find out that the recipient is sick, that may make a difference and may go to the next person. And there's other things that come up, but I can let those questions come up later. But again, the transplant center has 1 hour to decide. And timing is everything, because once the recovery starts, organs can only be outside the body for a certain period of time. And the 48 hours, from what I understand, is on the high side. Would that be? From what I heard, it's getting high when it gets to 30. So that's why it's important that everything has to be in place for it to happen, so that we don't lose any organs, so that we can make sure that the transplants do take place. But the need is great. There's 112,000 people that are on the list. The number of people in California, there's 21,000 people on the waiting list, and almost 17,000 of those people in California are waiting for kidneys. Here in our area, there's over 10,000 people in our service area waiting. And of those, almost 8,400 people are waiting for kidneys. This is the California waiting list, a little more specifically, so you can just kind of get an idea with ethnicity and then what the organs are that people are being listed for. So again, we've got about 21,000 people in California. 17,000 of those are waiting for kidneys. And then the numbers that are in red, which I'm not sure what color they show up on the screen, but the top in the bold, that's how many people are waiting in our service area. The largest group being Hispanic with 2,700, Caucasian with 2,300, Asian Pacific 22,000, African American 13,000. And this was based as of data that I pulled off on January 6th. Now, as far as transplants in 2011, this is information that's based on what's been reported up to October 31st. They're still working on reporting the last quarter of the year. So in all of California, there have been 1,600 kidney transplants. And just to take a look at specifically the number of donors and organs that were transplanted through the California Transplant Donor Network, this year was actually a record. We had 299 donors, and that equated to 1,067 organs. It's still nowhere close to where we need to be. And we continue to look for ways that we can improve the numbers so that we can have more transplants happen. But this actually started with, on an average, we get about 2,500 phone calls a year. The hospitals are reporting as imminent death, and from that comes the 299 actual donors. Again, I come in from the community development side, and so our goal is to go out and encourage a culture of donation. Because a lot of times people don't think about it, they don't want to talk about it. And it's really, really important for people to have the exposure to it, to see the good that it does. And so we have Donate Life ambassadors who go out and tell their stories, and they discuss the myths. We go out and we ask people to say yes and to tell their family and their friends about their decision. Because it's very, very important that this can be done somewhere other than when the tragedy occurs. We work with the DMV. We have people who go out and talk with the staff at the DMV. Again, that's because of the 98% that we have sign up through the DMV. We want to make sure that they're educated. We do classroom presentations. All three of these people are donor family members who've lost loved ones. And they actually go out to the high schools, they go out to nursing schools and talk about the importance of organ and tissue donation. We're working, one thing that we started last year was we started working with clinics, and we're working to get more information into health clinics so that people can talk and feel comfortable with their primary care people. And then we participate in health fairs. We do faith-based outreach because, again, when a tragedy occurs, people go to their place of worship. This is actually the San Francisco citywide revival up in the top left. And then down on the bottom, the people that are sitting around the table, those are actually clergy at San Francisco General. So we actually meet with them, and we have volunteers who go out and meet in hospitals and things like that to even talk to staff, to educate them about the importance of donation. But it's very, very important with the clergy because they're the ones that are also going to be working with families. We have social media as far as we have stories and things out on our Facebook site. We do Twitter. We follow UNOS. And we have a website. So you're welcome to go out to our website so that you can get more information and contact us. We run stories about our Donate Life ambassadors so that we can direct people here so that we can give them stories that will help inspire them to sign up to become organ and tissue donors. But we need your help. There's a lot that our organization does and that we're involved with the transplant, but we really do need your help so that we can continue to increase the number of people who say yes to donations so that we can increase the number of kidney recipients. So I do have some material in the back about our program. I also brought information that can give you more things about our organization. It's called Life Connections. It's a magazine that's in the back. And it actually shows you more information about where some of the organs did come from. Also in the back, one thing I didn't mention, one part that our family services do is that after someone becomes a donor, we stay with the family for a year, and we are the contact between donor families and recipients. So in the back, there are also brochures about writing to a donor family. And so if at any time you want to go ahead and get in touch with your donor family, you would write your letter, give that to your social worker. The social worker would get it to us. We would then contact the donor family. And if the donor family would like to contact you, then that will happen. On the other side, the donor family contacts us. They'll write the letters and send them to us. And then we'll go ahead and pass the information on to the transplant center. And then we will help try and coordinate meetings when that's needed. But that is another part that we do. Like I said, I put this together based on some of the things that I wondered about and some of the questions I had when I was going through the transplant. And I thought that it really did help to kind of know how does it work. You know, and what a difference, it made a huge difference to me. What could I do to go out and help make more happen? So, thank you. And we'll have questions later.